is, what is the risk of having no children? And let's look at the OECD data. It is worrying, it is concerning, and it calls upon every government which is facing this crisis to invest significantly more in treating infertile couples and helping infertile couples to access treatment earlier. Now, if you look at this data in summary, and if you see when can you define childlessness, usually the ages of 49 and to 45, where you can get an idea of saying that there may be no pregnancy. This data gives you some indication, though it's not absolutely accurate, and many of these are available from women born from the 1970s. So the proportion of women, including United Kingdom, Austria, Spain, it seemed that in the earlier data, around 20% of women may not have had children. If you look at other countries like Chile, Mexico, and Turkey, it is significantly less. In the United Kingdom, there's been a rise of 6 points for women who are aged 45 and have not had children. If you look at the graph, if you see the chances of not having a baby, it's almost at 21%, and that's scary. And this is data which is freely available. It is available online on the OECD data, and it's a call for governments to invest adequately and early for fertility treatments, without which you're going to see a significant challenge to populations. You're going to see severe relationship challenges as well as psychological and mental challenges, especially as you make patients wait over long periods of time or access only private care. Countries with the highest level of childlessness, over 15 years, also have low fertility rates, and women born around the age of 70, and that was what was seen. In extremely young cohorts, it's been difficult to try and find out the exact reason of whether childlessness did exist. So, what this OECD data does tell us is that it may be time that governments, irrespective of the economic challenges they face, have a clear look at what is their 5-year plan, what is their 10-year plan, and try and see if adequate funding across the board is given to all women or couples wanting to have a baby. And I think that is something which governments are trying, but it's also important to make access easier